Okay, we're broadcasting live.
Thank you. The attendees are joining. We'll give it a couple of seconds. Thank you for everyone that's joining us today for the special city council meeting with the subject COVID-19. I'd like to welcome all of our visitors and call the meeting to order. Roll call, please, Madam Clerk.
Mayor Gore.
Here.
Vice Mayor Bennett.
Here.
Councilor Randolph.
Here.
Councilor Holloway. Turned it up. Councilor Holloway. Councilor Parton.
Present.
Councilor Denton.
Here.
Councilor Pelham.
Present.
Thank you so much.
Is Councilor Holloway just having difficulties because she was there?
I know, I was just about to check.
I'm here.
Ah, thank you.
Thank you. I know the IT director is getting Crater Workforce Board into the meeting, and also Ms. Mcdonough from the chamber. Dr. Maker, the third person on the list, we have a note in our chat about the Crater Health District not be able to hear. So that's 3 items right now. So before we get started, we're just going to go over housekeeping rules again. Everyone's lines are going to be muted, so that way we don't have any background information or noise while we're trying to conduct this meeting. Members of council and the panelists, if you have questions, please raise your hand. I'll acknowledge you. If you have issues with raising your hand, please put a note in the chat box, and I'm tracking that right now so I can see if you have any issues, and we can address that accordingly. Council, if you would like to speak, and again, if your hand is having issues or you need to do a chat box, please just say, excuse me, or something of that nature, and we'll stop to address what your need is. We just want to make sure we're all not yelling out at the same time. Again, for the public, this is a special meeting for COVID-19. Some members of council, we really felt that it was important to have a meeting solely designed to discuss the city's response to COVID-19 and answer community questions. As the meeting notice said, that we asked for you to contact your member of council to ask questions. So that means that some of you will see a question and answer box if you're participating remotely. We are not tracking that box because we're not allowed to engage with the public right at this time during a special meeting. Maybe at a future meeting, we'll have a town hall, we can directly engage, but the goal was for you to funnel your questions through your member of city council. And hopefully the presenters that we have joining us this evening will address most questions. And if not, please follow back up with your member of council and we'll get those answers for you. So council, we do have 5 guests on the line tonight. To respect their time and to make sure that we're not duplicating efforts, I would like to see if all of the presenters can do their presentation, and then we'll open it up for the floor for council to ask questions. We talked about this in terms of processing. It may be that one presenter may cover something somebody else didn't, so it might be best just to wait to make sure that the question has been answered after everyone has spoken. So we will begin with John Randolph Medical Center. We have Joe Mazzo, CEO of the medical center, on the line to provide some updates. All of our panelists were given questions prior to this meeting to answer. Excuse me?
We have not had the motion to amend or accept the agenda.
Okay, 1 second. So all of our panelists was given questions in advance of the meeting to be able to see what some people were saying. And so we'll go in order of that. Is there a motion to adopt the agenda?
I have my hand raised.
Yes, ma'am.
I would like to amend the agenda to limiting each speaker to 10 minutes or less. And since the city manager is the director of emergency management, that he speak first and the mayor to follow. And during the discussion on the items for consideration, that we invoke our council rule of 3 times per counselor or 10 minutes, whichever comes first.
Second.
That's a lot.
Okay, so Madam Clerk, do you have the motion on the floor? It's before council now.
Still writing. To amend the agenda limiting each speaker to 10 minutes and to allow the city manager as director of the emergency management to speak first, followed by the mayor, and to invoke council rules for the 10-minute, 3-time only limit.
Okay, now we are into discussion. I see a hand raised by Counselor Denton.
I have a,
1 second, Counselor Cohen.
I don't see my hand.
It's not raised. Counselor Denton, do you still have a question? Is that you didn't put your
No, I did mine. Thank you.
Okay. Counselor Pelham.
Yes. Can we just delete the time limit for our panelists, because really we don't know what urgent information they have or vital information they have. I don't know the reason for the limitation, because this is the time that we requested they are our guests to speak about the situation overall. So if someone takes 10, somebody may take 15, somebody may take 5, but I don't think it's necessary to limit their time frame. I wouldn't agree with that portion of the amendment and request a friendly adjustment, a friendly amendment to alleviate that time limitation.
Counselor Denton, are you fine with that friendly amendment?
No.
So Counselor Pelham, she's not fine with the friendly amendment. Are you requesting to amend the motion?
Yes. Or we'd like to request permission first to amend the motion to eliminate the time limit for the panelists to speak in their entirety of what they want to present to our citizens.
I'll second that. The motion on the floor is to allow Counselor Pelham to make an amended motion on the floor. Roll call, please.
Councilor Parton,
No.
Mayor Gore,
Yes.
Councilor Denton,
No.
Councilor Pelham,
Yes.
Vice Mayor Bennett,
No.
Councilor Randolph,
No.
Councilor Holloway.
Sorry.
Yes.
Thank you. The motion fails. So the motion still on the floor is to limit the presenter's time to 10 minutes. Allow the city's emergency management coordinator and the mayor to speak first, and then to invoke council rules limiting each counselor 10 minutes to 3 speaking times. We're still in discussion. There are no hand raised. Those who are on the phone, do you have anything to comment? No one has said anything, so I have a comment. Just as a FYI, I spoke to city manager. The emergency coordinator is not available for this meeting, so he's going to be doing those alerts for the federal alerts. And also, we talked about this agenda layouts to try to make our time most efficient and respect our guests' time, and to spend the bulk of our evening addressing the city issues at the end, because that will most likely spur council discussion. So in an effort to make sure that we get the most pertinent information out to the public and respect our visitors' time, they were put to the top. Councilor Randolph?
Yes, ma'am. Thank you. I was just not clear on what was going to happen with our speakers. I think you had mentioned that there were questions that somebody gave them. Are they going to be updating us and answering questions? And secondly, I'd just like to clarify with if we're invoking the 3 times 10 minutes for each counselor, is that going to be per topic or speaker, or for the whole thing?
I can only answer the first part. I will defer to Councilor Denton as to what her intentions were with her motion. In terms of the questions for the speakers, council was notified in the meeting notice to reach out to your constituents or to compile the questions that you have been receiving so we can give those to, so council can ask on their constituents' behalf. Last night I sent out an email to all of council just reminding them to submit the questions by midnight so I can give those to the panelists. And today there are several email chains regarding the questions. I sent over what I had been provided. Only 2 members of council actually gave me questions to provide to them. And then I also had some from my constituents that I gave them. Most of the questions are generic in the sense that they've been questions that's been asked a lot in general. So hopefully they shouldn't be too difficult for our panelists to be able to answer because they're pretty common questions. The goal for this evening was for them to provide updates as noted in the agenda packet, and then to be able to answer the questions that were submitted to them or share any pertinent information for the public that they wish to provide at this time. We haven't had a meeting of this nature for them to directly communicate with our constituents. So the goal was for them to present and then to answer questions for them. Councilor Denton.
Yes.
I just wanted
Councilor Randolph's question in regards to how did you intend for the 10 and 3 minutes to be applied? Is it per presenter, or how did you intend for that to go?
Well, according to the agenda, SB 8, it says items for council's consideration. The only thing I have on SB 1 through 7 are really updates that we were asking our guests to provide us with. And I didn't see any place on here for questions. So that's why I did the 10 minutes, was because I felt that would be enough time to give them, to update us on the information that that the citizens might find helpful.
Right, so to get clarity, is it 10 minutes? Are you asking for us to limit it 10 minutes per speaker or 10 minutes total after the speakers have spoken?
10 minutes per speaker or less. And that's to give us their updates for the citizens of our city.
Correct. Let me ask the question a little bit more clear. You asked for council to be limited to our 10-minute rule with 3 times to speak. The question is, I understood it from Councilor Randolph, is how are you suggesting that be imposed? Are you saying that you would like to limit council to 10 minutes individually for each speaker, or after all of the speakers have spoken?
After all of the speakers have spoken.
Okay, thank you. Councilor Randolph, does that answer your questions?
Yes, ma'am. And I just want to put out there that I put on my Facebook page about this meeting, told people to ask me questions, but I did not submit any because I did not have any from any of my constituents.
Okay, thank you. Okay, there are no other hands raised. Again, for those who are participating telephonically, do you have any questions or comments? Councilor Denton, did you mean to raise your hand again, or was that an accident?
Yeah, I was just going to state as well, I sent an email to all of my distribution and told them about this meeting tonight and who was going to be here. And if they had questions, to please email me their questions or call me. And I did not hear from anyone.
Okay, thank you. So reminder, you guys, please keep our comments pertinent to the motion on the floor. And the motion on the floor is to amend the agenda, to limit each guest panelist 10 minutes or less presentation, and to invoke council's rules to allow council to speak no more than 10 minutes 3 different times. For clarity, council is suggesting that it be after panelists speak, allow the emergency management coordinator and the mayor to speak first. That is the motion on the floor. There are no hand raised and no one else has commented that they have a question. Roll call, please.
Councilor Parton.
I think Mr. Altman just had his hand up before we started.
Okay, Mr. Altman, yes.
Yes, ma'am, Madam Mayor. I would just ask, I think out of respect for our guests, to let them go first. I do appreciate the willingness to put us up front, but I think we need to be mindful of their time and let them go, and then we can get into the meat of our presentation. And I don't mean to step on anyone's toes, but just would like to be mindful of everyone's time on the line.
Thank you. We're going to resume with roll call, please, Madam Clerk.
Madam Mayor, if I may make a clarification, the way Councilor Denton worded her motion, she said to invoke council rule. The council rule is 10 minutes or 3 times per item. And so I know you sought clarification, but I really wasn't sure if is she invoking the rule or is she changing it to say something else?
She's referencing the rule. When she means invoking, she means using that rule, but she provided clarification as to how to use the rule. So it's just, yes.
And further, in the rest of her motion, what she was doing, she switched the order between you and the Director of Emergency Management. She didn't impact those going before you. And it didn't seem like that was clear, so.
Just switching 7 and 8.
Right, that's all she did. She wasn't putting Mr. Altman at the top.
Sorry.
Okay.
My apologies for not understanding.
Oh, she just wants Mr. Altman to speak before me. Okay, just for clarity, if people look at the agenda packet, it actually goes in order of forms of government. It starts with federal, then it goes to state, and then it goes to local. So just for clarity, that's how it was designed. And we actually work, again, the city manager and I walked through the agenda line by line to talk about what would be covered and how to feed into the next step. So, okay, finish roll call, please.
Councilor Pardon?
Yes.
Mayor Gore?
No.
Councilor Denton?
Yes.
Councilor Pelham?
No.
Councilor Pelham?
No.
Thank you. Vice Mayor Bennett?
Yes.
Councilor Randolph?
Yes.
Councilor Holloway?
No.
Okay, thank you. We're going to move on with actually doing the meeting now. So we're going to move into our guest panelists. I apologize for the delay. Thank you again for taking time out of your busy schedules to join us and to provide updates for the community. Mr. Mazzo from John Randolph Medical Center, you're up first. You have the floor, sir.
Great. Thank you and good evening, everybody. I appreciate the opportunity to talk on this important topic. I want to start by saying at John Randolph, we continue to be vigilant in our access to our hospital. As I mentioned earlier on a previous call, our company, we've used the knowledge of our company and the 180 hospitals across the country to gain insight into this horrible disease very early on. That allowed us to begin the process and necessary planning to prepare for this. We started by screening, by isolating our entrances and screening all employees. We continued to move and conserve our PPEs appropriately. We began to identify spaces and plan for a large influx of patients and to appropriately train and expand our labor force. We continue those efforts each and every day and are diligently working to ensure that we meet all the needs of the community and our patients. I'm happy to report that as of right now, we don't have any shortages in all those key areas, testing, supplies, or labor. Again, because of our preparation and because of our vast experience across the country, we've gained insight and knowledge about this disease. So I wanted to open up with that, and then I will go ahead and address, there have been several questions that were raised, so I'd like to go into that if that's all right.
Yes, sir.
One of the first questions was around testing. As it has been across the country, there's been a lot of focus on testing. And the first question is, why don't we test for the COVID-19 when they're having symptoms? And again, HCA and John Randolph, we use the CDC criteria that's been established for us to determine whether we test or not. It's currently the decision of the physician to determine whether or not to test. The test is important to know. The test is not intended to be an assessment of your risk, but it's to confirm if you have it when you have the symptoms. And remember, a positive test does not change the course of the illness. And I use the analogy of a seasonal flu, where when we're in peak flu season, many times providers do not test, even if you are slightly symptomatic, because the course of the treatment is the same whether you have it or you don't. The same is true for COVID-19, and what we're finding is that someone has mild symptoms and they come to the emergency department and they don't require admission, we're not going to test them. One reason is because that treatment is the same. You're going to isolate, you're going to take care of your symptoms at home. A second and very most important reason is what you're seeing across the country is if we go ahead and test those individuals, every individual, even those that do not require inpatient admission, we will then exhaust all testing and the important medium that's involved in testing material. And then we will deplete significant resources, not only in terms of the testing, but in also terms of the PPE required to test. So we reserve our tests for those that are admitted, that are symptomatic and will be admitted to the hospital, so we can get a quick turnaround and conserve our PPEs. Another question came up around, at what point will testing open up for those that don't meet the current guidelines? And again, I'm not aware of if that would ever open up. The CDC just published criteria that we are following on April 2nd that puts emphasis on a couple key groups. One is healthcare workers or first-line responders who have a fever or symptoms. Two is groups of people who have unknown respiratory illness, such as in a healthcare facilities. Three is hospitalized patients with fever or symptoms or signs of lower respiratory infection. And four are people who live or work and congregate in certain areas such as nursing homes, detention centers, assisted livings, and have a fever or lower respiratory tract infection. So those are the guidelines from CDC, and those are the ones we follow to ensure we're testing the appropriate people. Again, not to expend unnecessary resources when it will not change the course of the treatment. Another question that was raised, is it safe to come in to the hospital for anything other than COVID-19 right now? And this is where I want to stop and pause and let everybody know, and I want the community know as well as the council, that you should have the confidence in John Randolph that yes, we are prepared. We are managing patients each and every day. It is safe. We have begun and we have limited entry with temperature screenings weeks ago. We screen all of our patients. We screen all of our employees. To date, there's only been a few people hospitalized with COVID-19. The rest of our patients have gone home and have not been admitted. Those who do require hospitalization are carefully screened and isolated in a special area where all the appropriate resources and treatment is provided. And so not to provide risk to any other patients or staff. It is absolutely safe at John Randolph, and we're doing everything we can to continue to provide a safe environment. So I do not want the message to go out that anybody who's suffering from any illness or issue, they should feel comfortable knowing that they come and can get that treatment. We just had a patient a couple of days ago that came for a life-threatening stroke, and we were able to provide life-saving clot-busting drugs in 25 minutes. So we are still providing great care. We're still able to do that because we've prepared. We have the supplies and resources and expertise to do that. Another question that came up, is there enough testing for Hope Health? Yes, we have enough tests. Again, we work collaboratively with the region and other health systems to ensure that we have all the necessary supplies and equipment. So we do have enough testing. There was a question about the process taking. I'd like to know what the process is being taken to test those who need to be tested. And again, I believe I answered that in the previous statement.
Mm-hmm.
Then there was a question about the plans if both our competitor sister hospital, Southside and John Randolph, filled with patients. What would be our plan? And again, as I mentioned earlier, we drill, we plan for many different scenarios, and we are prepared for this scenario in particular. We have the benefit of having a large campus with many rooms, and so we have explored and had plans for how do we expand and accommodate not only the staff, the supplies, but also the room. So we are prepared and have plans to do just that. And at this time, we have not needed to do that. And the last question was, does the hospital have enough space? And the answer, again, as I mentioned, is absolutely yes. So with that, that concludes all the questions that I have received.
Thank you so much for the update. And if you don't mind, just at the end, per the motion that was passed, council will be able to ask you questions after all of our panelists. I really do appreciate you taking time out to answer these. Thank you again. We're going to move on to Dr. Hart from Crater Health District for any updates and to answer any questions provided to him. Dr. Hart. On the roll call earlier, maybe his line is muted. Mr. Altman, can you work on contacting him to see if he got disconnected? We're going to move on to Dr. Hackney from Hopewell City Public Schools. Dr. Hackney.
Good evening. Can you hear me?
Yes, ma'am. Thank you.
You're welcome. Good evening, City Council. I appreciate the opportunity to be here and to share with you some of the things that we are doing as a part of the school system. I will say that in my 5 years that I have worked here and my 15 years of being a superintendent, I have never been more proud of our team of administrators and instructional personnel, our support staff, who have all mobilized beautifully to ensure that we are adequately prepared and responding to this situation that never in my lifetime would I have thought we would be facing. I'm going to also get right to the questions in just a moment, but I do want to share that just overall, we immediately upon the governor's orders closed all of our buildings and moved to teleworking as much as possible. We then mobilized 10 action teams that each of our administrators have been assigned or volunteered to support. Those 10 areas are student wellness, staff wellness, instructional continuity, food services and operations, messaging, communication and technology, accountability of staff while teleworking, continued work on our budget and ensuring an uninterrupted payroll and benefits to all of our employees, continuing our leadership work on the implementation of our balanced calendar coming, we hope and pray, this summer. And the last two are on focusing on non-traditional ways to recruit teachers, although I'm really pleased to say that our numbers are lower than they have ever been in terms of staff who have expressed their intent to either retire and or resign. So hopefully that's not going to be too big of an issue. And then how we pivot to ensure that there are plenty of professional development opportunities for employees at all classification levels while we are attempting to balance realistic work that can be performed at home and ways in which we can grow professionally during this time for duties that cannot be accomplished at home. So I will say that for the good of everyone listening, and in particular our city council, we're in good shape. I want you to know that we've got this, and we're going to be fine. We have not rushed to put hasty and ill thought through procedures in place. The guidance that we are receiving both from the federal government and our state Department of Education has been changing, sometimes daily. So our first and always priority is to ensure that our children, our students are safe, that they're fed, that they know that they are still loved, even though we can't be with them Monday through Friday in person, that they are missed, and that we're all in this together, and we'll get through this. We also want to make sure that our parents and students know that no one is being punished because of this situation over which none of us had any control. So how we work those things out and ensure that our students can successfully promote to the next grade level and or graduate for our class of 2020 is something that we're working very, very diligently on, and are messaging that already. So I'm going to go directly to the questions and answer those for you. The first question was, is HCPS still on track to start the balanced calendar? We sure hope so. At this point in time, we fully plan to continue to move forward with our plan for balanced calendar this summer. As I said earlier, these have been extremely crazy and unpredictable times. And you know, we're looking at all those factors and making decisions routinely. At this point in time, there are no plans to change the 2021 calendar or the start date of school. If our plans do change, and they could, updates and announcements will be made as soon as possible. And if there are any other specific questions around balanced calendar, Byron Davis is our supervisor of the implementation of balanced calendar, and he can be reached either by email or phone at the central office. There was another question that has there been a new deadline set for kindergarten registration? If so, what date will be the first day? You know, this would have been, and we're all working, so I don't want to send a mixed message, but this would have been our traditional spring break. And so we have used when we would have returned from spring break on Tuesday, April 14th, as the point at which we will be disseminating new information, instituting instruction through the end of the school year, which I will share with you in just a moment. So with respect to kindergarten graduation, we're going to provide a couple of ways for parents to obtain that paperwork. Probably the easiest way will be to fill out a brief form online from our website that will allow you to download all the paperwork. We can also mail that to you. A little bit later in my 10 minutes, I'll share with you when our administrators are available by phone and directly. And I would encourage any parent who is nervous or concerned about any of these traditional deadlines to talk to us, call us, talk to your building principals. But it's really important to us. And I will be honest, I was somewhat troubled by one of the comments in one of the questions that kids and parents are stressed about grades. There are different circumstances in households that are being overlooked. I want to assure everyone that we're not intentionally overlooking anything. And that's really the reason that we are being so thoughtful and taking our time to put supports in place that provide equity for all children. We have a lot of diversity in our school district, and some children have internet, some children have don't. So we're not overlooking anything. If anything, we're being extremely thoughtful to make sure that we put the right supports in place and connect our families that some may have unique needs to ensure that they are well equipped to do something that they've never been asked to do. We're going, I'm going to share that in a little while, but kindergarten registration is an example of that. Nothing is normal anymore. So any deadlines that were previous to COVID-19, we're not worried about that. We will get these babies registered and they will be okay. The other option is we can, we now have mailboxes at each of our schools. So if anyone wants to download the paperwork or have it mailed to them, they can drop that back off at the school in the mailbox at the front entrance of the school. We can review the paperwork and then follow up by telephone or email on any missing items. But I can't stress enough, I don't want people to be worried. We're going to make all this work, and it may be different and it may be unique. But as I said earlier, no student or family is going to be consequenced because of the circumstances in which we find ourselves. There was a question about how have the schools been sanitized and how are they being cleaned? The answer is absolutely yes. They have been sanitized and are sanitized routinely. We've put our custodial staff on rotating shifts in all buildings. They are doing deep cleaning of all bathrooms, wiping down every student desk, all the furniture, doorknobs, light switches, mopping the floors. That is ongoing, and I am confident that all of our buildings are in good shape and are safe. I am happy to review the questions with respect to grading. The question was, I referred to earlier, kids and parents are under stress about final grades. There are a lot of different circumstances in households that are being overlooked. The notices put out to the public do not directly answer questions about grades for all kids. Yes.
I'm sorry, your 10 minutes is up unless council wishes to extend that.
Someone like to extend the
I would like to make the motion to allow the superintendent of Hopewell Public Schools to allow her to finish her presentation and answering of the questions she had.
I second it.
I second it first.
Hey, the motion has been made by Vice Mayor Bennett to allow the superintendent of schools to finish her presentation and answer the questions provided to her. That motion's been seconded by Councilor Denton. It's now before council. Is there any discussion? And one moment, Mr. Dane, you have your hand raised, sir.
No, ma'am. If I do, it's by accident.
Okay, thank you. Is there any discussion? None. Roll call, please, Madam Clerk.
Council Parton,
Yes.
Mayor Gore,
Yep.
Councilor Denton,
Yes.
Councilor Pelham,
Of course, yes.
Vice Mayor Bennett,
Yes.
Councilor Randolph,
Yes.
Councilor Holloway.
Yes.
Thank you. Go ahead.
I apologize, my friends. Being quick, brief, and succinct is not one of my strong suits, but I'm gonna talk fast. But thank you for the opportunity, because I think one of the big things that seems to be worrying some people is grading. And again, this is one area where the guidance has changed several times. There was a reference in the question that other schools and cities have already announced what they are doing. And I will just say, as just a point, several of those in Region 1 who've already announced, as of recent guidance, are having to go back and rethink their policies, because there are a number of factors that many of us wouldn't even have anticipated. How this affects GPA, how this affects Virginia High School League, NCAA standards for grades and eligibility. So we are definitely not behind. If anything, I'm proud that we are being very thoughtful and making sure that what we do is in the best interest of our children, and even if it may take us a little while. So I will be very brief. Elementary and middle school grading, what we have decided to do is the same. Obviously, continued learning for our students is important for them to be on track when we're able to get them back and our buildings reopen. At the same time, grading for the rest of this school year will be determined obviously in a different manner from what we're used to and what is typical. And I think that's probably what's making people nervous. There's nothing normal or typical about this situation. The way we have decided to determine a student's final grade is to use their grades from the first 2 quarters along with the 3rd quarter up until the school buildings were closed on March 13th. Students will have the opportunities to improve their 3rd quarter grades, such as if they were missing work or hadn't been able to turn everything in, maybe had been absent, in direct coordination with their teacher. We won't be distributing report cards for the 3rd quarter, but instead we will issue one final report card that will include the 3rd quarter in June. So to put that simply, we will be sort of dividing the school year that we would normally do in 4 grading periods into 3 grading periods. Now, that doesn't mean that we're not going to continue to provide them learning opportunities to continue through the end of the year, and we're going to do that. But with respect to grading, we're going to base their final grade on what they accomplished when they were here until March 13th. That is for both the elementary and the middle school, or all the elementaries and middles and the 1 middle school. High school is a little different and unique because they're both on the 4x4, and we have a lot of other factors like dual enrollment and AP and some things that we can't necessarily fully control. For 9th through 11th grade students, and obviously I'm going to separate our seniors because they're unique and different, and we're going to talk about that in just a minute. For 9th and 11th grade students in courses except those dual enrollment ones, which obviously the credit is also awarded with from the community college, grades will be determined on the basis of completion of weekly learning assignments in each course that we will be facilitating for our students starting Tuesday, April 14th, in combination with the grades that they received up through March 13th when schools were closed. Students will be able to submit missing work from earlier in the semester before the schools were closed, and the grades for these courses will be pass-fail rather than a letter grade. This will enable students to still gain credit for the course, but it's much simpler for them. They will either pass or they will fail the course, and we're going to work really hard to make sure they pass. If the students have undergoing exceptional circumstances and are unable to complete the work by a deadline that we have set of May 29th, then we will assign them an incomplete grade, and we will provide additional opportunities for them to complete the work when they return to school, even as late as the beginning of next year. So worst case scenario, a student grades 9 through 12 will receive an incomplete, and we will create opportunities and structures for them to make up that work when they return to school. Best case scenario, they will participate in these weekly learning experiences that I'm going to tell you about in just a minute, that we provide for them with teacher oversight and involvement, and will be on target to receive a passing grade before the end of the school year. That's our goal. For 12th graders and our seniors, there is a strong commitment, both locally, I know I don't have to tell you that, but also with our state superintendent and the State Board of Education, that our seniors receive significant and added flexibility so that they are not negatively impacted by our circumstances. Our goal, obviously, is to have them on track to graduate and ensure they're prepared for whatever their next step is. For all of their courses, except again, dual enrollment courses, where we have to follow the rules with the community college, their grades will be determined on the basis of completing the weekly learning assignments in each course that will begin on April 14th, in combination with course grades that they receive through March 13th. As you all, I think, are aware, our high school is on a 4x4 block. So we were only, I think, 5 weeks into the beginning of the course in second semester when schools were closed. So we've had to look very differently and uniquely at those students. Seniors will also have the opportunity to submit missing work from earlier in the semester before schools were closed. The grades of these courses will also be pass or fail rather than a letter grade. And this will, again, allow students to gain credit for the course, but they will not be factored in their GPAs. To ensure that students are on track to graduate, we are reducing the window for instruction for seniors. We are going to work hard partnering with them and their families to ensure that they are able to complete all of their assignments that they receive starting April 14th through May 15th. So, and I will tell you, frankly, the reason we're doing that is, and that's 2 weeks before all of our other students wrap up around the end of May. We're doing that to take advantage of those 2 weeks so we can personally work with any senior during those 2 weeks between May 15th and 29th to get them where they need to be so that they can be sure to graduate. So that's our motivation there. Again, we're working very closely with John Tyler for dual enrollment courses. Those kids are generally completing those courses online in conjunction with their professors and some of our staff, and we're following their guidelines, and we have Dr. Peggy Westcott, who is working very closely with each of those students and managing their cases personally, one-on-one with the students and the families. So just to give you an idea really fast, on April 14th, which would be the Tuesday that we returned after spring break, and we needed this time to obviously get this together. We've mobilized teachers of all grade levels, pre-K to 12, to develop plans through the end of the year every other week on Tuesdays, simply because that we'll start it on a Tuesday. We will be providing students new packets of lessons, either online or hard copies, for 2 weeks worth of work. They can either be picked up, they can either access them online, and we're issuing any students who have internet capability Chromebooks, and we have enough for every student in the district to have that if they have connectivity. Or they can come on Tuesdays between 10 and 2, every other Tuesday, starting on the 14th, and pick up packets outside of the front door of the schools for those students who do not have access to internet. I am extremely pleased that we will also be checking out additional Chromebooks on those days as well, that our IT and technology staff have been working really, really hard to increase and provide internet access to all students who do not currently have it. And right now we have been assessing all of our schools through individual surveys. We're still working on this because there are a number of people who have not responded to our survey, but generally I'm pleased with the results. We have in any one of our given schools anywhere from 61% to 88% of our students who have access to internet. So that's the good news. The better news is that we have entered into a contract with Khajiit, and we are going to be putting wireless routers. I hope I'm saying this correctly. I'm not a technology person. Wireless routers on 31 of our school buses. And with the permission of the City Council, and I've already discussed this with City Manager Altman, we would need some flexibility with your ordinance of where to park those school buses. But our goal is to strategically park all 31 buses in different places throughout the city. And each of those wireless routers will provide up to 60 students with wireless internet access. So, and that is far more than what our surveys are suggesting we need. So we're comfortable that that could also allow for some of our adult citizens and families to be able to access this as well. So we have got that ball running. The last we heard from them, and everybody's trying to, is competing for this right now, given the circumstances we're under. And so everything's on a first come, first served basis, but they're working really hard with us. And our hope is 14 to 17 days to have that up and running. So we were shooting for aligning that with the 14th. That's not going to be realistic, but it's definitely should be realistic, not later than the 3rd or 4th week of April at the latest. So we're excited about that. The other thing I just wanted to share with you, and then I'm going to stop, is that we have just this week, we have put, we've added to our website and Facebook and all of our social media platforms, we have added a link to frequently asked questions, FAQs, 2 links actually, one for parents and families and one for our staff. So I would encourage any of you and any of our citizens in the city to look at that. We've answered every question that we can think of and that we've been asked so far. And we have a link where people can ask a new question, and we will very quickly turn around an answer there. So I don't feel compelled to get too into the weeds, if that's okay with you, because there are very, very comprehensive responses to many questions, to include those that have been asked tonight on our frequently asked questions under our COVID-19 plan link. So I think, the last was, what tools are the schools using to help parents and teach from home? How are we helping those who do not know how to use a computer and tablet? Our IT department has set up a system by which parents can call them remotely, and they can walk them through any tech related issues and concerns. We've actually had some Google glitches in our Chromebooks that we have worked through that with our students and families. There will also be technicians available every other Tuesday at our buildings to help anyone who needs support. Yeah, our teachers are required to reach out to no less than 3 to 5 students every single day, both to check on just their well-being and their attitudes and their motivation, and tell them they love them, and to assist them with their instruction and learning. But the other thing is we have messaged all of our phones at our schools to encourage people who have questions that they want to talk to a live human being to call the school board office. Starting on the 14th, we will have again a rotation of full-time secretaries Monday through Friday that will man the phones and will get specific questions to anyone that needs them that's working from home to be able to respond personally to anyone who has questions that they can't navigate through our social media and website. So I apologize for taking so long. I hope that covers everything.
What hour?
Thank you, Dr. Hackney. That was great. Really quickly before we move on or open the floor up, IT, can you please check your private chat? Joe from the hospital dropped off the line, and I gave you his cell for you to contact him, please.
Hey Mayor, I'm still on. I wanted to provide the opportunity to answer a couple of questions before I jump off.
Oh, you had to jump off. Okay. due to his time constraints and commitments, is council okay with just at least allowing anyone from council to ask him any questions before he hops off the line, before we finish our presenters?
I
Yeah.
don't have a problem with it.
Fine.
Thank you. So if you do have a question, please use your hand button, or at least just ask to be acknowledged instead of just jumping out and asking the question, so we can keep track of everything. Councilor Palmer, I know you keep trying to jump in. Do you have a question for Mr. Mazzo?
Yeah. I had a question for Dr. Hackney, but I can't remember the question I had for him. But
Can you hold your question for Dr.
I
Hackney?
will. I will.
Any other questions for John Randolph Medical Center? Okay. Well, thank you again, Joe, for joining us. I really do appreciate it. And you helped out with the town hall that we had the other day, and that was really great. I appreciate it so much. And you seem to be very open to answer all questions. So thank you for taking time out of your schedule to do so. Is there any other last minute comments you have to share before you hop off?
No, thank you for the opportunity. I appreciate your time. Thanks.
Thank you. All right, Dr. Hackney, I know you were just wrapping up. Is there anything else you had to say before we move on to our next presenter?
I had a question.
No, ma'am, I'm fine.
Councilor Palmer, I know you have a question, but the motion that was passed was to wait till everyone spoke and give it council 10 minutes. That's what Councilor Dent's motion was. So, Councilor, Dr.
And Mayor Gore,
yes.
Mayor Gore, I'm available. I will stay, so I don't have to leave. So I can be available for questions later.
Okay, perfect. Thank you so much. Okay. The next person that we have is Dr. Hart from the Crater Health District. Dr. Hart, are you back on the line? All right. I think there seems to be like a disconnect with his thing. We'll go back to him. I'm sure Mr. Altman is reaching out just to clarify. We're going to go down to Becky Mcdonough with the Hopewell Prince George Chamber of Commerce. Ms. Mcdonough, are you there?
She, I think, is on the call, but I'm going to speak for both of us. We've been adjusting to being able to do all this remote stuff as well. And I know she's out in Prince George with not great internet and a storm going through there. So, but I think she is on the line called in. So, so I'll speak for both of us. Just to give a report, I don't believe, according to the email I got, that we actually had any questions directly sent to us. So I'll just kind of give you all an update on what we've been running into and what we've been doing. We serve in two capacities. One as, of course, the Hopewell Prince George Chamber of Commerce. And then we're also, for those of you that don't know, the destination marketing organization for Hopewell and Prince George. So I'll start with the membership piece of that. Of course, we're doing anything and everything we can to provide support for our members first and foremost. That's mostly at this point included communicating with our members, other regional groups and organizations, including city government, Prince George County government, Virginia's Gateway region, Small Business Association, and a bunch of others that we've been talking to, including on weekly conference calls about sharing information and seeing what everybody's doing and what's going on. We're trying to gather as many resources as possible from, what we can find, what we're being sent, as well as these other organizations, to make sure we get what our members need to them, especially right now our small businesses, because of course they're struggling a little bit more than the others. We've picked up a few new members. We've been calling almost all of our existing members individually, asking them exactly what they need and what we might be able to help them with. And that's resulted in us being able to provide some sort of assistance or getting them in touch with someone else who has the resource that they need. So we've been pretty valuable in that so far. And we've also managed to do some stuff for non-members as well. And of course, we're still responding to anything that's non-COVID related as best we can. We've supported a lot of different member initiatives over the last 2 weeks, including connecting some businesses that had extra PPE equipment with John Randolph Medical Center so that they could help stock up some of their supplies. We got some hand sanitizer donated to Brighter Living. So we've been working on some things like that, again, trying to connect people in the emergency response sort of vein where needed. And then we're still working on doing that now. So if anybody knows people that have extra PPE equipment, or, you know, I know Brighter Living is still looking for hand sanitizer donations right now. So them and any of our other assisted living facilities, maybe keep that in mind. We've also had quite a few members that we have helped in spreading the word about their food drives and various projects like that, including Breezin did one that benefited the Hopewell Food Pantry, Wind Supplies doing one out in Prince George to try to donate to some food. Some of our restaurants, Pasta Diner, Luca Italian out in Prince George, J. Caraway Media, James R. Jones Builders, we've been helping all those people get their message out that they're running some of these campaigns to get food and other things donated to those in need. So having that mouthpiece of our, you know, member communication tools has been pretty important for that. And then we got together with the Hopewell Downtown Partnership in creating a GoFundMe campaign to try to raise money to provide meals for John Randolph Foundation, John Randolph Medical Center staff while they're working at the hospital. And something that kind of overlaps between both our membership piece and our tourism piece. We also, as you may know, with Virginia Tourism Corporation, the last week was Restaurant Takeout Week in lieu of having a restaurant week, which is a normal thing that happens every year. We went and launched a campaign to try to support that so we could get some assistance out there for our restaurant members and non-members. So we had we went out photographing some of our quote unquote local celebrities getting takeout to try to encourage people to get out and still order takeout or get curbside from any of the restaurants that are still open if they were willing or they could. And all that has sort of driven a lot of our social media through the roof, as I'm sure doesn't really surprise anyone with a lot of people at home online. So our role so far as membership has been very much communicating and supporting members in any way we can. And now I'll move over to our tourism piece. Our office is in an official Virginia Visitor Center, which of course was mandated to shut down along with all Virginia welcome centers and visitor centers by Virginia Tourism Corporation. So tourism is taking a big hit right now. Most of our tourism partners that we've talked with are sort of considering 2020 a wash, as by the time most of this, even if June 10th is the earliest date where the lockdown is finished, we'll basically have lost most of the tourism season. So that's a little bit tough, but everybody's still very optimistic, and we're all sort of making plans looking at optimistically again, the end of the summer and the fall as still being a possible salvageable tourism season, and seeing what we can do for our tourism partners as far as still driving tourism there. We're still sending out our RAC card to the other visitor centers around the state, hoping that we can attract some people at the end of the year. We've put an ad out in Richmond Magazine, which we're still hoping will get some traffic maybe once all this is over. And we're optimistic about the future on that front. So we're still working like it's not all gone, and that we're going to be able to get some of this back, hopefully in the near future. So that's about all I've got.
Thank you so much, Daniel. I appreciate it. We're gonna move on to, I know that Dr. Hart, they were into the line, but there's an issue with us hearing them. I wanna see if we're able to hear them now. Dr. Hart, are you there?
Yes, can you hear me now?
Yes.
Wow. Well, good evening, Council, and thank you for this opportunity to share with you tonight. I want to assure Council and the residents of Hopewell that the Crater Health District has been actively responding to the COVID-19 crisis. Joining me tonight, I have two members of my team. We have activated our incident command structure to respond to the COVID-19 crisis. And so I have on the line with me tonight, Katrina Safri, who is our Chief of Operations. She's our epidemiologist. And I have Deborah Whitaker, who's our Emergency Preparedness and Response Coordinator, and she's serving as our Chief of Planning. So I just want to share with you, currently we have 15 positive cases in Hopewell. That was one of the questions. Another question for us had to do with when will this peak, the number of cases. And so at the present time, the estimate is that we're looking at mid-May. However, we know that this is based on various projection models, and there still is a lot of work being done around modeling, but this is not exact. This is just an estimate. Another question we received, what are the actual numbers and what is the prediction of the virus if we cannot set curfews for businesses and citizens to help contain this nasty virus? And so right now, it's important to recognize that this is a new virus. That's why it's called novel coronavirus. And so we're still learning quite a bit about this virus. So in terms of predictions, again, we're looking at models, but the main thing that I want to stress as it relates to this question and curfews is the importance of social distancing or physical distancing. And so I know that there have been some challenges, and the governor has talked about this in his press conferences in terms of people not honoring the physical distances, and that is remaining 6 feet apart from individuals. And so I just want to stress the importance of physical distancing when it comes to this particular issue. And if you have further questions about that, we can come back to that. Another question we received, keeping in mind identity confidentiality, why is it not shared where these individuals have been confined or confirmed with the virus, been in the city, and when? This would help calm fears of people thinking they may have been in the same space. And so I'm going to ask my epidemiologist to actually address that issue. Some of the work and a lot of the work that we're doing as it relates to COVID-19 and responding to positive cases has to do with contact tracing. And our epidemiologist, Katrina Safri, is in charge of that work. So Katrina, are you on?
I see her name listed as a panelist, but I don't know if she's having the same sound issues that you were.
So we'll give her a minute. Part of our contact tracing involves working.
She just
Are you there, Katrina? Did she just disconnect?
I think she's back on now. I see her her phone icon is like she's talking, but nothing's coming through. IT, is she muted on our end?
No, she's she's not muted. She just, it looks as if she's having some technical difficulties on her phone.
Okay, so if you're listening, can you just hang up and dial back in? She just messaged me. She said, I'm sorry, I'm not sure why you can't hear me. If you have the dial-in number, just hang up and dial back in, and we'll see when you pop up in the feed, and we'll connect with you.
All right. Well, we'll come back to that question while she's getting reconnected. So I'm going to allow Deborah Whitaker.
Did he just drop off? Okay, I think Dr. Hart just dropped off. So we'll give them a moment to dial back in, because I don't want to go to the last presenters and they come back in and they can finish addressing the questions. Everybody's watching and participating. Just give us one moment.
Hello, this is Deborah. Do you hear me?
Yes, ma'am. How are you?
Good. Sorry, somehow we just got disconnected, cut off without notice. My apologies.
Okay.
Thank you. So my name is Deborah Whitaker. I'm the emergency coordinator for Crater Health District. For the past 4 weeks is we've set up a group group meets every Thursday afternoon from 1 to 2 p.m. And we have been working now for a little while. And one of the things that we've decided to do is we send out a daily report to our emergency managers, and your city manager is also copied on that, Mr. Altman. And those daily reports give you an update on what changes have occurred, what case reports have been shared, both with Department of Virginia. Within Virginia, it talks about how many tests have been conducted, what cases have been confirmed. For example, right now we're looking at 3,333 cases as of 5 p.m. today, how many hospitalizations and how many deaths have occurred in the state of Virginia. Dr. Hart mentioned we had 15 confirmed cases, and then any other pertinent information specific to your jurisdiction. We have also established through this work group a daily 911 isolation report, and what that refers to is we do an update of confirmed cases specifically for the city of Hopewell, and that is designed to give your 911 dispatchers information by name and address and phone number of any confirmed case within the city of Hopewell. That information, that daily report, 911 isolation report, goes directly to Ben Rupert, and then Ben Rupert will share that information with 911, and that information is then shared with your fire, EMS, and law enforcement. There are very specific guidelines as to who can receive that information in regards and specifically around the HIPAA and the confidentiality, so we're not violating public health or personal health information. That contact list has a very defined and very strict chain of release, and so that's why it goes only to your emergency manager, Ben Rupert, and he will share that. That 911 isolation report is designed to protect your first responders only, so that when they do get called out to a call, again, whether it's fire, EMS, or law enforcement, they will use the proper PPE, that's personal protective equipment, so that they are protected when they're handling a call. And that is one of the efforts we wanted to share with you tonight on how to protect your first responders so that they're not exposed to COVID-19 within your communities. As you can appreciate, this is one more effort to reduce the spread of COVID-19 within the community. And one of our primary focuses, of course, is always protecting our first responders. We do this whether it's a pandemic for COVID, we do this when we have an outbreak of any type of disease, whether it's a flu outbreak, whether it's H1N1, whether it's Ebola. First responders and our key leaders are always, and healthcare workers are one of our first groups that we look at protecting, because if we can't protect our first responders, our healthcare workers, then we can't take care of our citizens, which is one of our primary focuses. So we have to be able to do our jobs. And that is one of the key efforts that I wanted to share with you tonight. Thank you. I'm going to give you back to Dr. Hart.
All right. Thank you, Deborah. Now I'm going to see if Katrina Saffrey, our epidemiologist, is back on.
Don't see her name in the panelist section. Unless she's dialed in as a number without her name.
Okay. So I'll just share with you briefly in terms of the contact tracing. It really is extremely important that we follow each positive case that is made known to us. And so we make contact with those individuals, and then we find out who they've been in close contact with. And close personal contact we are defining as less than 6 feet for about 10 minutes, 10 to 15 minutes. And this definition of personal close contact is changing, but we use that right now as a guide to determine who needs to be self-quarantined and who might need to be tested. And so that's all the job of our epidemiologist. So that is very active work, particularly at this point in time. Although we share with you, we have 15 cases in Hopewell, but for the Crater Health District, all 8 localities, we have 69 cases of COVID-19 across the district. And so it's quite a bit an undertaking for our epidemiologist and our communicable disease nurse to do all of the contact tracing. So that is a very active part of helping to keep the community safe. However, we're not able to share all of that information because of HIPAA. We're not able to share personal information that would be a violation of that law. I think that covers most of the questions we received. Are there any additional questions you have for us?
Unless you have a time commitment, unfortunately, the motion that was passed was to wait till all the presenters. We have one more presenter. Is that possible for you, or do we need to get you first?
We could wait.
Okay, thank you. Thank you for the presentation, Dr. Hart and Ms. Whitaker. We're going to move on to our last presenter. It is Ms. Pierce from the Crater Workforce Investment Board. Ms. Pierce, are you on the line still?
Good evening. Yes, I'm on the line. I'm joining you all now by the phone.
Okay. Do you want me to still pull up your PowerPoint that you gave me?
Yes, please. Okay, and I'll basically just be referring to that for information and to leave you you guys in Hopewell with some information of contact. Can you all hear me okay?
Yes, ma'am.
Okay. Well, good evening. Thank you, Mayor and Council, for allowing the Crater Workforce Board to serve on your panel this evening. I do also have joining on the call is our one-stop operator, Sean Nicholson, to help answer questions that may be pertinent to some of our partners with the Virginia Career Works. But I'm not sure how, what you all know of the Crater Regional Workforce Board, so I just wanted to open up by giving you all just a quick synopsis of what the Crater Workforce Board is and how it relates to the Virginia Career Works. The Crater Regional Workforce Board is the regional convener and administrator entity that coordinates workforce training and career services through the federal funding service called Workforce Innovation and Opportunity Act, better known as WIOA, that was passed in 2018. We work under the guidance of the Virginia Community College System, but also we're overseen by the chief elected officials from the 9 localities within the region, of course, to include Hopewell. We provide services through our brand, which is called the Virginia Career Works. And for your citizens, some of those who may have had opportunities to visit, one of our locations is in Petersburg on Washington Street. And then we also have a center that's located in Emporia at Southside Community College within that facility. And so just in case, I'll just allow Sean a little bit later. I'll be brief tonight. I just wanted to talk about some of the services that we have available. Our one-stop centers are closed to the public, of course, at this time. But we want the public to know, that your citizens to know, that they still can access services over the internet, and they can still call our facility. We have our switchboard operator there who can help connect people to resources. But we encourage citizens to go online to connect with the services for the Virginia Career Works. We provide services, general services, to include services for youth who are ages 16 to 24 years of age through our youth provider, which is called the POWER program, serviced by the Pathways that are located in Petersburg. But also we have adult services and services for those who are dislocated workers. And so we are still able to access services, have services, citizens connected to those services. And so I would encourage any citizen who, one, truthfully, if they're still searching for a job, because there are jobs that are available within the region, which the VEC is designated as the partner who connects our citizens and workforce to job opportunities. But through ordinarily, what the process is that citizens will access WIOA services. And when I say WIOA services, these are federal dollars that provide individuals who are seeking job assistance, career training, educational training opportunities to get credentials and certifications in in-demand job industries. And so those services, even though we're not able to connect individuals directly to a training provider at this time, we use multiple training providers located throughout the region. They are still able to contact our Virginia Career Works to access services. The state is working on us, trying with us to try to get eligibility processes intact, because this unprecedented crisis is going to last for a little while, and we still need to be able to provide services to individuals to help connect them to training and job opportunities. So what I would just encourage you all is I provided to the mayor a slide that gives our contact information, as well as our email and telephone contact information. And so hopefully she'll be able to make that accessible to you all for the Virginia Career Works. I want to share some information on behalf of one of our very vital partners, which is the VEC. Of course, everyone knows that the VEC, they called in the past, it used to be called the Unemployment Office, but it's actually the Employment Office. But they are having tons and tons of calls and people contacting them to file unemployment claims. And so I've provided also information that the VEC has given to us as far as helping people to ensure that they are able to connect to unemployment, to file a claim for the first time, or as well to renew their claim, because it's something that's a process that, you know, takes place weekly that people will have to do to ensure that they get the benefits. So I've provided that information. And since I can't see, Mayor, are you able to put that up? The
yes,
one-page flyer?
Information up, and now I have to sign up with the claims.
Okay, so what we want you all to know is try your best to go online, because the calls they're being overwhelmed with calls at this time. And so we encourage you to do your claims online. If for some reason you're having a difficult time, and I'm speaking as the VEC is a partner, I'm not speaking on behalf of the VEC as an official person on behalf of them, but they're a partner to our Career Works. And so they want you to know to go ahead and call and file online. And so that information is provided to you all. I also want to ensure in the third slide, it gives information about the CARES Act, which is new information that came out that we were provided today. The CARE Act provides increased benefits for workers collecting unemployment insurance by $600 claims effective March 29th until July 31st. Increased benefits for eligible claimants under the traditional unemployment insurance will be starting we will start to be paid as soon as the next week. And so there's the link. So you all please share that link so that people will know that they can access it. And there are additional resources out there. Also, new benefits for previously uncovered workers. So people who may have not been covered, but also for individuals who are private or self-employed are able to apply as well now. I'm going to just switch over quickly to just give you another piece of information. The Crater Regional Workforce Board was provided funding by the governor's office a couple weeks ago to do something called the rapid response for small businesses. We put out an announcement a couple of weeks ago and to see if there were any employers who were in need of dollars. We had a very small pocket of money, but we allocated the funds to the various localities. And I've shared the information. I know Mr. Dane has been a part of some of the calls and conversations, but I have shared information. And what I want you guys to know, the deadline was yesterday, but Hopewell, we had only one respondent of a small business to apply. So not a lot of time, but I would say if any small business is in need of some financial assistance, which is reimbursable, they would have to spend the monies first. But for financial assistance, that's going to prevent layoffs and also to prevent the business from closing. And so we've had a lot of restaurants to apply in the other areas. We've had child care facilities, doctor's offices to apply, basically for sanitation needs and for technology to help with telework. So those are the in-demand things. And the funds are more so for those in-demand labor market areas. But right now, if someone have a question or are interested in getting more information, they can contact me at the number that I've provided on the slide. Pretty much, I think that's all. I don't want to take up too much time, but just to let people know that they can still apply for jobs by going to the Virginia Career Works website. because there are some employers such as Walmart Distribution and several others who are still hiring. So, you know, I know it seems, you know, glim and, you know, but there are job opportunities that are still out there. A lot of, I know all the risk and things like that, people, you know, not moving around, which we want people to follow safety precautions that are provided by the health department. But there are jobs that are out there for those who have to work for those essential industries. And pretty much, I don't have anything else. I didn't have any questions that were provided, but I do want to allow Sean Nicholson an opportunity, if I have time, maybe about 2 or 3 minutes, to share on the Virginia Career Works Partners if he's still on the line. Is that okay?
Yes, that's fine.
Okay. Sean, are you there? Sean? Okay, I'm not sure if he's here. But if he's not able to join, I guess basically, were there any questions?
All right, well, let me just double check with Sean if he's not muted here, because he was.
Okay.
There's 2 different creators still registered. I don't think that's Sean though. But
so right now this weather has been bad. I know he was moving around, so he may not be on one.
Okay, well, if he gets connected again, we'll, you know, go back to him. Is there anything else real quick, Ms. Pierce, before we open it up to council for a question?
No, that's all for me, and I'll stay on the call.
Thank you so much. I appreciate it.
Thank you for the opportunity. Thank you.
Okay, so council, we finished our guest speakers for this evening to provide questions. Now it's open. Oh, Sean just texted me. I think he said he's on. Are you there, Sean? I don't know. Okay, we'll have to figure that out. All right, so we'll work on that while council gets their questions. So there is a hands raised from the Crater Health District. Go ahead.
Let her know.
I think Katrina, you had your hand raised.
I was gonna say it must be Katrina Saffrey.
Okay, go ahead.
I think she might still be having technical difficulties.
Katrina, are you there? I think so. I think I see her microphone, her phone doing the same thing it did last time, but no sound. And the same thing for Sean. Sean, if you can disconnect and dial back in, maybe by then we'll be on system questions. We can say them for you. But we don't hear you. I see the phone doing an icon movement, but it's not coming through. Okay. So while they disconnect and get started, put back into the system, we'll open up the floor to council. And as the motion that was passed stated, council is limited to 10 minutes per person with 3 times to speak. And so council, please use your hand icon to be acknowledged so that way you can.
I don't have one.
On the floor.
I can find my hand. Can I speak?
Go ahead.
Yes, Dr. Hackney, how you doing?
I'm good, thank you.
Thanks first to all the presenters. Thank you for the information. I think it's been very useful. You mentioned that a secretary would be at the school board. Is it Monday through Thursday? And what would the hours be?
Yes, ma'am. It's gonna be starting on Tuesday, the 14th. It will be Monday through Friday, regular office hours, 8 to 4:30.
8 to 4:30. Okay, thank you. And
You're welcome.
all right, and I think the workforce young lady, Miss Pierce. How you doing?
Yes.
Nice to see you, hear your voice again.
Nice.
Okay.
Hi, Ms. Pelham.
All right. And the extra unemployment money, is there anything extra they have to present or anything, or is that just gonna be like a stipend to the end of the employment benefit?
Will be remiss. I would just I don't want to answer that. Basically, I would ask and suggest that they contact the VEC directly because I don't want to misspeak.
Okay, great. All right, thank you.
You're welcome.
Good to speak to you again.
Councilor Pelham, are you done with the floor for now?
I think so, ma'am.
Thank you. Councilor Parton?
Thank you. This question is probably going to be for Dr. Hart. It might end up going in a couple other folks. So if they have something to say, please chime in. But with the 15 cases that Hopewell has, do we have a map maybe per se that shows the areas or the points that they visited, kind of backtracking some of their steps and maybe pinpointing an area that might have seen an increased potential in coronavirus outbreak, whether it's a store, whether it's a grocery facility, a park, a public space, something along those lines, and which maybe the city could look into cleaning maybe more, or letting maybe a store owner or business owner know to ramp up cleanup efforts because they were in those areas.
So we don't have a specific map, but that is a part of our contact tracing. So we look at the amount of time that a person has been in an area in terms of being close to someone, whether it's within the 6 feet, 10, 15 minutes. And so that is the basis of our contact tracing to determine who needs to be self-quarantined and those kinds of things. But we don't have a particular map.
Okay.
But we look for trends. So I'm sorry, go ahead.
Well, that was, I think you're about to answer my next question. Go ahead.
So we do look for trends, and we look for evidence of clustering and those kinds of things. And so we don't do it like by map, like you would sort of visualize, but we do it by looking at our data points and having communication and collecting data for those persons who have tested positive.
Okay, so with those trends, do you have them, I guess for an example, if it ended up being that you would go to a hardware store, for instance, so people needing things to fix their house, being still an essential business, and there was a trend that we started seeing people go toward those facilities. Is the Crater Health District contacting those businesses when you start seeing trends like that to let them know? I don't know, maybe I'm not doing a very good job of explaining what I'm trying to ask.
Can anyone hear me?
Yes, ma'am, we can hear you.
Oh my gosh, I'm so sorry. This is Katrina Saffrey, the district epi. Hi, Dr. Hart and everyone on the line.
Thank you for joining. We got through.
Hi, it's Deborah. We got disconnected again. Sorry about that.
Katrina's on. She got perfect timing. You want to answer that for Council Parton?
Sorry, I'm just want to get us on speaker. So I'm having trouble with that. So we're having all kinds of technical difficulties
Was
tonight.
she in that same office? Because I think she dialed in a separate line.
We can hear you.
Okay.
I can anyway.
Okay, let me speaker.
Can you hear me?
Yes.
Yes.
Hang on.
But
Hang on for a second.
Okay, but is Katrina on a separate line? I think she dialed in separately, correct?
She's on a separate line.
Yes, she just came in. Are you still in?
There we go. We're back.
Okay.
All right. I'm sorry. We're sorry about our technical difficulties.
So it's Katrina, you were on the line?
She was.
Oh, dear. Okay. So the question again, just please refresh your memory. You were talking about clusters. We're talking about trending.
Correct. Yeah. So if there's a trend of people, the 15 individuals that have been infected with the coronavirus, if we see trends going to a specific type of business or a specific business or a public space area or a a meeting area, a playground, if there's a trend in an area, do we reach out to the business owner or the city, the locality, or the neighborhood to kind of inform them of the trend?
We reach out to those business owners, yes.
Okay. All right. Thank you.
Mm-hmm.
And really quickly, Katrina, I think your number's still on. Are you still there? Just when she got through. Well,
So just to recap, part of the initial case investigation with the confirmed case includes developing a list of persons who came in close contact with the case. We define a close contact as a person who came within 6 feet of a confirmed case for 10 minutes or more. And so we've been contacting all of those individuals and providing them information, on quarantine and monitoring themselves for symptoms. And those persons include household contacts, coworkers, and other family members. Those efforts have been our priority and will have to, and will have the greatest impact reducing the spread of the virus within our community. So we also collected other facilities that those cases have visited, beginning from 2 days before their illness onset period. And so we've been reaching out to those facilities and providing them with the general time and date, if known, that the confirmed case visited their location. We also provide guidance on how to clean and disinfect high-touch surfaces and answer any questions that they may have. That's been our process at this time, and in order to adhere to HIPAA policies and also to be able to help mitigate the risk of transmission at those locations, we're also providing similar guidance to workplaces of confined cases. So hopefully that gets to your question.
Hits it perfect on the head. Thank you.
Oh, you're welcome.
Thank you. Counselor Parton, are you done with the floor for now?
Yes, I'm done.
Okay. I don't see any other hands raised. For those who are on the phone, is there any questions of anyone? Okay, so there's still no hand raised. Then I don't think anyone jump in. I have a question for Dr. Hackney. The survey that you gave out to the teacher and to the parents in the school district, would it be helpful if council were to share that on as well on our behalf to get people to try to participate more, or is that you don't think that would be helpful?
I think that would be fine. What we have decided to do, because in some schools we had minimal response, what we've decided to do is ask every homeroom teacher to actually contact those families directly and in person get an answer to the question, because we really want to be sure and accurate when we look at putting these supports in place and where we put the supports in place. So I'm happy to share you the survey. It wouldn't hurt. We're doing it, we're collecting it now by school, but our hope is that by doing it in person with the teachers contacting at least all those people who did not respond, so that we can make sure it's representative of the majority of our students and families.
Perfect, thank you. Ms. Pierce, for the grant that you were talking about for reimbursement, I know the deadline has passed, but it's reimbursable money. So is there opportunity for businesses to still try to solicit reimbursement after the deadline, or is it pretty much a done deal at this point?
Hi, can you hear me?
Yes, ma'am.
Okay. The deadline extension is through till tomorrow. The application is really a very simple process. And so I would just encourage, if you have a business that may be interested, based upon our call tonight, ask them to give me a call as soon as possible. Contact me using the information that I have provided. But like I said, the main reason is we have to get information to the state to provide information so that we can start the reimbursement process. And so just encourage them to give me a call. But I would say my extension is up. It was due on Monday. The extension will be until tomorrow.
Okay, and after this tonight, I'll send an email to you, the chamber, just in case they don't have it in the downtown partnership, just to make sure all three of you guys are connected, in case if communication hasn't gone through to everyone. So that way, at least you have that. Maybe you could put out a blurb to all their partners or all users, maybe to try to do a last minute push to get people to participate.
And what I would say, I did get, Becky Mcdonough did assist somewhat also today. So we had a call earlier today with the Virginia Gateway region, and from there we were able to get one response. So I know that the chamber, the Prince George Hopewell Chamber, they have had information and are helping to get it out, so we appreciate that.
Okay. Does anyone else have any questions of our panelists? Oh, sorry, Councilor Pelham.
Yes, Dr. Hackney as well. If the kids that have these learning packets have questions, if their parents can help them with that, who do they contact? The secretary at the school or the principal? And what time are the principals at the school? As you can, I'm out of the net.
Can you hear me, Ms. Pelham?
Yes, ma'am.
Okay. The school, we've closed the schools down except for every other Tuesday, but we're messaging the answering machines to say that starting on the 14th, all calls should be made to the secretaries at the school board office, and then the secretary at the school board office will funnel them out to whomever they need to talk to, whether it's an individual teacher, whether it's the administrator. But every other Tuesday, the administrators will be in the buildings starting on the 14th, but they can be accessed through the school board office secretary, who will get any message to them, and they will return those calls within 24 hours.
And they will be there for 8:30 to 8. They will be there from 8:30.
Yes,
ma'am. Okay.
8 to 4:30.
Principals will be there in the building, correct?
No. On Tuesdays, the hours are 10 to 2, but yes, the principals will be there 10 to 2 for people to pick up, but the principals will be there on those days during regular business hours.
Okay, thank you.
You're welcome.
Thank you. Just one last try. I think Katrina just got back in. Are you still there or no? I think she was trying still. So I just want to thank all of the panelists for joining us today for this meeting. Each of you were very gracious, and immediately when I asked if you were free, you said yes, and you were available to answer any questions the public may have had, and you've done just that. So thank you for being great community partners and representatives for the city of Hopewell and all that you do. Please be safe while you continue to work in your fields. And if we have any other questions, we'll be sure to send those over to each of you. And again, thank you so much for your time. Have a good night if you're going to.
Thank you.
Thank you. You can stay on, but just in case you have something else to do. So council, we're going to move on to the next portions of our agenda for this evening. I'm switching back over the screen to back to the agenda packet. Does everyone see the agenda packet now?
Yes.
Okay, thank you.
I do anyway.
All right. The next item is the federal updates, but they pivoted to Mr. Altman for the City of Hopewell COVID response. Oh, no, actually, they went over me for the state. So can you do the federal updates, Mr. Altman?
Yes. Just so everyone's aware, the federal government's taken action at different times during the process of COVID. So starting back in December, everyone was alerted to the outbreak of COVID-19 in China. Center for Disease Control established their incident management system on January 7th. From there, they activated their Emergency Operations Center. Congress actually passed the Coronavirus Preparedness and Response Supplemental Appropriations Bill, which provided $8.3 billion in emergency funding to federal agencies. Next significant action taken by the federal government was the Families First Coronavirus Response Act. It actually went into law, became law in March 18th, but became effective April 1st. And it provided paid sick leave, tax credits, and free COVID-19 testing, expanded food assistance, unemployment benefits, and increased Medicaid funding out to families in the community. And then additionally, as we all know, most recently, they passed the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act, which responds to the outbreak and its impact on the economy, public health, state, local government, and individuals and businesses. So this is what's the information coming out now, particularly related to and what the Creator Workforce discussed with regard to assisting our small businesses in the area. And we, just as a plug, and we'll also make the announcement at the end of the meeting, in conjunction with that, we are having every Wednesday at 9 a.m. during the month of April, we will be having a small business workshop in conjunction with the Creator Business Development Center to talk about the SBA incentives and assistance that can be provided to small businesses in the city, and really anyone in the region that wants to tune in, they can. So we're doing that. Those are the significant actions that have been taken by the federal government thus far. I'm sure that as this goes on, there'll be more things that come. There is some discussion of potentially yet another stimulus package that may come soon, and then certainly one that they've talked about that would occur at the end of all of this to provide additional funding for businesses as they get started back up. So that's the brief overview of the federal steps thus far.
And we, when you and I were discussing the agenda packet, we added 2 quick things on this page.
Right. IRS, in case anyone is interested, has extended your tax filing deadline from April 15th to July 15th. So you have a little bit of time to get your federal taxes in again now. And then also they've extended the census deadline to, I believe, August 14th is the deadline for filing your census information. It began April 1st, and we would encourage everybody in the city to file their census information, because ultimately that census information equates to dollars and assistance that we get from the federal government to the city ourselves, and certainly to our school district. So please go out and complete your census forms. So census equates to money that comes to our local community. So we would encourage all families in the city to go out and do that.
Thank you. And the last update that I got from the census response rate, I think we were at 40% for Hopewell in response to the census. I'm checking now for updated number, but as Mr. Altman just stated, it's really important for as many residents as possible to complete the census so Hopewell can get our allocation for the next 10 years for funding. And you can do it by phone, you can do it by email, or you can do it written. And as of right now, Hopewell is at 44% response rate.
That's bad.
Okay. So that is up. That's all that we had for the federal updates. You wanted to do this in order as federal, state, and local to keep everything succinct. Council, do you have any questions regarding any of the federal updates provided?
Yeah.
Councilor Pelham.
Yeah. Is there any way that we can get information out about census other than internet? I mean, reverse 911 calls or something. That's a pretty low percentage if the deadline was 8. And anyway, we would have missed it. And that's quite a bit of funding, I'm sure. 44% of 22,000 is low.
So funding, census information submission just began April 1st. Okay. And the deadline has been extended to August 15th, I believe, or August 14th.
14th.
We still do have some time, but we can certainly continue to do our push locally on our social media, our webpage and even through maybe the FOIA list and different things. We really do want to not overuse our code red, which is that reverse 911 feature, because we don't want people to get accustomed to thinking they're just getting a reminder call, because when those go out, we really want people to pay attention because something's about to happen or has happened. So we want to minimize the use of that as much as possible. We don't want to dull the senses, if you will, that, oh, that's just, don't have to worry about that. They're just calling me about something. It's another robocall. But we'll certainly look at what we can do to push that message out and get with Ms. Griffin, who's heading up our census effort on the staff side, and we'll make some efforts to get that information out to everybody and encourage them to meet the deadline well in advance of August. But so far, you know, I know our family did ours. So we just, as the mayor said, I think the important piece here is it's funding for the next 10 years. So, you know, it's important to get everyone accounted for so we can get as much federal funding and assistance as possible.
And Councilor Pelham, to add to that, I'm on the Census Committee, as you know, and we're actively talking right now about how the other modes of communication to get the word out. So Dr. Griffin is setting up meetings to talk about that. We talked about doing something in the paper, making social media posts. I'm supposed to be working with her on that and some other things to adjust our plans due to COVID-19. So that information will be coming out to council soon, but she's doing some research right now.
Can you tell us how many people should send back in the census for Hopewell? I mean, because it doesn't equate to 22,000, I'm sure, because that includes children. But the high school students, do they have to fill out individually if they're 18, or do they?
So it's done by household.
So household letters that were sent out were probably 10 to 11,000, I guess.
Yeah, so we can give you that specific information offline. We can send out to all the council, but the census is done by households. And so that we have that tracking sheet, and our point of contact at the Petersburg office is giving us up-to-date information, and we have an Excel sheet that we're going by. So offline, we can bring more information to council. We can add this at our next agenda meeting if you would like to have more details. Just let me know after we talk if it's enough for you, and if not, we can put it on the agenda for our next meeting.
And if you have it by ward, the number of people who responded, that would be good too, so that we can emphasize it in our individual wards.
Okay, we'll see if that's possible.
Thank you.
Any other questions? Okay. All right, Mr. Altman.
So from the local level, we sent out a timeline of events that we have kind of compiled of what we've been working on, plus what the federal and state government has done, kind of big milestone markers, if you will. So briefly, just to let the citizens know what we've done since that outbreak in December. The first COVID-19 case was announced on March 7th in Virginia. On the 12th, Governor Northam declared a state of emergency for the Commonwealth. On the 14th, we declared a local state of emergency. Then the 16th, we closed all of our public buildings to the citizens and residents. Our employees are working a normal schedule. We're using telework and rotational schedules as an option. But what we've done is we've established a citizen drop-off center in the old lobby of the old police department, where citizens can come in and drop things off. Building permits can be submitted there for our development department. You also have the opportunity to use the treasurer's drop box out back in the parking lot. It's a painted old post office box drop off. So you can get information to us in those fashions. And then on the 17th, as we know, was when the Hopewell Public Schools announced that they were going to close for 2 weeks. The 18th, we've established a COVID-19 Citizens Hotline. That number is 804-541-2391 for our citizens to call in. You have options. You can call in and there's an update on there, or you can talk to one of our employees. and ask questions. We have a set of frequently asked questions that were developed and then expanded upon based on the questions we receive from citizens. So all of our employees that are answering that line all have that same information that they can provide everyone. The big item for statewide on the 23rd of March, Governor Northam issued Executive Order 53, which closed all schools K through 12 for the remainder of the year, and then mandated that food establishments offer curbside takeout delivery services and close to the public. So those are some of the big items that hit with Executive Order 53. On March 27th, we had our first confirmed case of COVID here in the city. At that point in time, we had some discussions from staff perspective where we were initially. When we did the building close, we did it for two weeks, hoping that, as everyone had talked about, there would be this curve that would get flattened and we would see some return to normalcy. We then extended that closure through April 24th. Then we also, at that point in time, we've canceled all recreation, sports, and activities for the spring season. We've been processing refunds to all of those that signed up for programs, sports leagues, events, and different classes. So we're working to get those funds out to people. They may not come out. They're going to come out in batches because it's a lot, but we're working to get those refunds out to individuals. We've closed our playgrounds in the process. We've, difficulty cleaning the playground equipment, and out of a desire to protect the citizens, we went ahead and made the decision to close our playgrounds. March 30th, Governor Northam issued Executive Order 55, which is the stay-at-home order. That runs through June 10th. He directed Virginians to stay at home other than except in extreme limited circumstances. You can, if you're part of those that have an exemption, an essential business or a job, you can go to work, seek medical attention, care for others in the household, go to the grocery store, the pharmacy, those types of things. But that was done on the March 30th. On March 31st, VHDA, the Virginia Department of Health, reported widespread community transmission of COVID-19 through the state. So we're in a situation now where there's before initially there was a lot of transmission and cases as a result of travel. Now that is spread throughout the state where it's because people are coming in contact with one another. So that's where the stay-at-home piece comes into play, if at all possible. We've also, in addition to our call line, we've developed a directory of services for our citizens. We've posted that on the webpage, and also the individuals that are answering our hotline have that available to them. So if people call, have a question on how to access one of our departments, they have the phone number and email addresses to get to those departments. We also have posted on our webpage and completed a resource for senior citizens to provide them some resources during this situation. And again, as we talked earlier, we've conducted one outreach in conjunction with the Longwood Small Business Assistance Center, a Zoom meeting, much like we're doing now, for our local small businesses to discuss the SBA opportunities and the elements that are coming out of the federal government with regard to the stimulus. That was on April 3rd. And again, we'll have our second meeting tomorrow and then every Wednesday after that in April. So that's just kind of briefly where we are from a timeline perspective here in the city. I know that Ms. Whitaker earlier in her presentation kind of gave an overview of where we are. Again, we have 15 cases here in the city. There's a total of, in the Crater region, of 69. We don't have any deaths here in the city to date, and we're hopeful that that will remain. But we receive a report every evening, and Mrs. Whitaker said, with updated numbers. We then turn that around. We send that out to council, and we should be posting that information, that report out on the web for citizens to access. There were also questions that were provided to us with regard to where we are with different things in the city. So just so council and the community knows, we have what's called a COOP. It's our continuity of operations planning. We're revising that as we go through this process, but where we are right now, as I said earlier, is we're operating under a normal operating schedule. Our buildings are closed to the public. We do have the public access area in the former police department lobby. Citizens can also use the treasurer's drop box. We're allowing our employees to telework and departments to rotate staff in the office. That's all at the direct discretion of the department head. And I will assure everyone that staff that is at home is working. Some staff have the ability to answer if their desk phones at home. So we are working. If you have a question, continue to contact us, and we are here to do business with the community. Quick update on our inventory of our PPE. We have an ample supply of our sanitizing cleaner Varex, which is a germicide. Fire department, has made bottles of that, distributed it to each department. We put it in our vehicles, police, fire, and any other vehicle that would like to have some for those that go out and interact with the public. But it's not just like Lysol. This is a heavy duty product that has to be, you use gloves when you clean, but we have that there as a cleaning supply for everyone to utilize. We are still waiting on our order of hand sanitizer. So if the Chamber of Commerce can help us out, that'd be fantastic. I heard they're helping out some other businesses, and make a plug as a member, that, if we can get a little bit of hand sanitizer, that would be fantastic. Our N95 masks and gowns, we have about a 58-day supply of masks and about a 37-day supply of gowns. We should have gotten a shipment of the masks in today or tomorrow, and gowns will be coming in shortly thereafter. What we're dealing with is we're reporting our usage or our burn rate to the State Department of Emergency Management, their Emergency Management Center, and they're looking at everybody's burn rate, how many you're using on a daily basis, and then they're providing additional supplies to those that are burning the fastest. Well, we're a small community. We may not be burning as much of these because our call volume versus someone like a Fairfax or a Virginia Beach. So we're trying to work regionally to see if there's an opportunity to come together to put our numbers and boost our numbers to see if we can potentially move up the line a little bit. But we do have supply on hand, and we are expecting shipments of those PPE to come in soon. From a financial standpoint, we have issued a freeze on hiring and holding vacant positions open. We have suspended any non-essential purchasing till the end of the year. And we are looking at where we are. We are currently making purchases for any COVID-19 related expenditure. We're coding that in our purchasing system so we can easily develop a total of those expenditures when this is done for FEMA reimbursement. And to date, we've expended about almost $14,000 in COVID-related expenditures. All of that has been done with an existing operating budget expenditure, so we haven't had to go to council yet and then make a request for additional funding to address the situation we're operating within our budget. That's one of the reasons why we wanted to limit non-essential purchases, so that would provide us some flexibility as we move through this event should something come up. Should some things come up, we do have we have some funding available to us from if we needed it, we could go to council. There's some dollars in the Economic Development Fund that we had for the workforce program. Whether we'll get to do that this summer or not is kind of in flux. That's about $60,000. Our operating budget contingency is about $173,000 that we have to be able to utilize towards our needs. And then if things really got to the point that we had a serious situation, we always have our rainy day emergency fund, which currently has about 5.2 million in it. We would hope to not have to tap those dollars and be able to get through the end of the fiscal year, just utilizing what we have now and making smart expenditures. But those dollars would be available to us. As we've talked about in a little bit earlier, we're pushing out information in some various ways. We've got the old standard tried and true press release that we push out via email through a written notice. We've established our COVID-19 webpage to post and update information there for the community. We use our social media, the city's Facebook and Twitter accounts, to push out information. We do have Code Red that we have sent out some notices to the public, but again, we don't want to overuse that because we want the public to respond and react when we send that warning out. We do have Nixle, which is another avenue that we can send out information. So I would encourage our residents to sign up for those if you can. Additionally, you could contact the clerk's office to request to be added to the FOIA list. And then you have there on the screen our Facebook pages. If you go to the city's Facebook page, and then or you can follow us on Twitter. Those are all ways that we're utilizing to push information out to the community. And then again, if all of those things are a little too technologically advanced for some people, call that hotline number that I gave earlier, and there will be somebody there on that line at 541-2391 to answer questions. And if we do not have the answer to your question, we'll take it down and find it and respond to you. So those are the ways that we're pushing out information at the moment. We've received some questions regarding how we're dealing with certain issues, one of which is dealing with homeless population in our vulnerable community. Friday, we learned that Governor Northam had allocated some funding to assist with the homeless population. We've learned since that St. Joseph Villa has received that funding, and that was provided by the governor, and they'll be using that to fund motel vouchers. So priority will be given to those individuals that are unsheltered, over the age of 65, and or those who have underlying medical conditions. So all of our individuals that we had in the city that had been participating in our warming shelter have been added to this list to be in line to receive a voucher if once the priority pieces with the age and underlying medical conditions are met, then they'll go down that list, and hopefully all of our residents that have a need will be provided. But we have submitted, and our representative from Catholic Charities who helped us with our shelter is monitoring that situation for us, and is working, has put all the names on the list and working to move forward. We've gotten some questions regarding parks. So our parks are open. We've closed all of our playgrounds. We are encouraging people, as one of the things the governor has said with his executive orders was he didn't close parks because people need to get out. However, we are strongly encouraging individuals to practice social distancing while they are at our parks. We've had some incidences here in the city where we've had very large gatherings, 100 or more people at a park, cookouts. Those items and those activities flow in the opposite direction of what we're trying to accomplish with reducing our curve and getting a handle on the outbreak here, particularly in the Commonwealth and in our community. So we're happy for you to take a walk through our parks, but practice that social distancing, that 6 feet, no large gatherings, because if it continues to happen, we may have to take a step and close all parks. And that isn't something we really want to do, but we may be forced to do that should the situation get out of hand. One of the items that we have that has been curfews. Council did provide us with the authority to impose a local curfew if needed in their adoption of the declaration of a local emergency ordinance. At this time, the administration isn't considering a local curfew. That isn't to say that things wouldn't change, but we are not at this point in time. And certainly if the governor or the president enforce a curfew, then certainly things change there, and we'll be following their directive. But at this point, city administration has not had any discussions of having a curfew. We certainly hadn't had those discussions with council to inform them of our thoughts, but we do have the ability. To go back to one other item, so we've had some questions and that have come in regarding a internet rumor or conspiracy theory about 5G cell towers and their connection to the spread of the virus. I want everyone in the city to rest easy. We do not have any 5G towers in the city at this moment. So please don't go out, as I've seen articles on the web where people are burning cell towers down. We need our cell towers to facilitate good communication amongst our citizens and their family members and with us. But we do not have any 5G towers in the city at this point. So I won't even try to debunk the internet conspiracy theory, but just please note that we don't have any 5G towers in the city at the moment. We've received several questions regarding childcare and daycare centers. So yes, daycare centers, individual daycare centers can be open. It's that now some may have closed, but some are open. And that was one of the things that Governor Northam in his executive orders did urge parents who can stay at home with their children to do so, to allow the prioritization of children of parents who work not in the essential sectors, so healthcare workers, police, fire, and others that have to go to work, for those children to be able to go to daycare centers. Child care center that remains open, they do have to employ cleaning and social distancing requirements in keeping with the Department of Social Services guidelines. And there was a question with regard to unlicensed daycares, and I think at this point that's not something that is being actively enforced. But again, social distancing is the key to all of this, and you're limiting your number of children in a room to 10. So whereas you may have your daycare center may have had 15 or 20 children in a classroom, now it's going to be limited to 10 because of the social distancing piece. So just be aware of all that's going on. We've had some question regarding gyms. That was one of the items that Governor Northam in his executive order closed. So gyms and other entertainment theaters, they're closed. So we shouldn't have gyms operating in the city right now. Those facilities should be closed. Their members are going to have to find another way to exercise, but gyms were closed effective March 24th through April 23rd per the governor's executive order 55. We've had some questions regarding taxes. So, as we said earlier, the federal tax deadline has been extended to July 15th. Virginia's deadline is still May 1st. And we've had questions come in from businesses regarding BPOL, meals, lodging taxes, what kind of assistance can be provided there in the state sales tax. The taxes actually have to be paid. That's something that we cannot waive. Council later, and if they choose, could discuss. I think we have it potentially as a discussion as an option at the next meeting, waiving penalty and interest or delaying or extending the due date on those. Those are things that are within that realm, but those taxes have to be paid. We can't waive or not collect them, but we can do some things to address that. We've also had questions regarding churches. So the guidance that has been put out from the governor's office with regards to churches are that attendees may travel to their place of worship You can park in the parking lot, listen to the religious message while remaining in your vehicle. Participants must remain in the vehicle at all times. There must be no more than 10 individuals leading the religious ceremony or function outside of the church in support of the ceremony. Any interaction by faith leaders and those in the vehicles must be strictly limited, such as using social distancing methods when passing out palms, serving Holy Communion, using sealed or uncontaminated elements, and priests directing congregants to place ashes of water on their foreheads as opposed to priests applying the ashes or water directly on foreheads. So we understand with the time of year we're at, that it's very important for those individuals in our community to attend and feel that connection to their congregation at their churches. But we do ask that you do them within the realms and the guidance that have been provided by the state. The same applies to offerings. So if there's any question about that, you can go to the state's COVID-19 webpage, and there's a frequently asked questions piece, and you can pull that down, and then there's a specific pull down regarding, can I attend church? So that's there, and we ask that anyone that has questions would go there, but also we ask that all the leaders of all of our faith leaders in the community also are aware of those guidelines, so we're protecting everybody when they come to worship. We've had some questions also regarding our convenience center, our solid waste convenience center. We closed that initially. We have reopened it as of today. We are back to normal operating hours, Tuesday, Wednesday, and Friday from 12:30 p.m. to 3:30 p.m. and Saturday from 8 a.m. to 4:30 p.m. The one caveat is staff at the convenience center will not be assisting residents with the unloading of any materials from the vehicles. So you will have to come in, you will have to offload it yourself. Staff isn't going to be there to help you pull that couch or that washing machine off of your truck or your debris. Staff will be there. We will be manning it, but we're trying to limit our employees' exposure, protecting their health, their well-being, and that of themselves and their families. So we're trying to limit interaction. So again, staff will not be assisting residents with removal of debris. So we've got council also.
1 second, Mr. Altman. I think you skipped over sewer and trash. I think it was the last one I had on my note.
Okay. So the sewer and trash, those bills, there was some discussion. There's been some question regarding one, we're not doing cutoffs. That was established early on in the process during this. We weren't going to cut anyone's trash collection or their sewer, or the water company's not cutting water service, power service. We do have some question regarding trash and return of toters to off of the front. We're flexible in this time with regard to everyone's concern with the trash man that touched it. You know, did that person have anything? Are they not contagious? A lot of the collection we have now, not every one of the vehicles, but we do have vehicles that come on that have an automated arm that dump. But for those that have questions regarding taking their trash can back, we still want you to take it back. We don't want it to sit out by the road. We're probably a little bit more lenient at this point in time with regard of enforcement of the time period and the fining of people getting it back. But I would suggest, if you have any concern, if you have a Lysol wipe or a Clorox wipe, use that to grab the handle, or take a paper towel or something if you have one, and pull it back. If not, the simplest thing to do is follow the CDC guidance. Pull it back to your house, immediately come inside and wash your hands. Wash your hands for 20 seconds, which is the CDC guidance for almost everything that we're doing right now. Good hygiene. So whether you're coming home from the grocery store or bringing your toter up from the road, come back in the house, wash your hands with soap and water for 20 seconds. If that's not available, and if you have it, use hand sanitizer with at least 60% alcohol. But again, practice good hygiene to address those concerns.
When we had a discussion earlier, you said if people have concerns about people violating the guidance, such as the gyms and other places like the park, they can call the non-emergency number.
Yep, call the non-emergency number for the police department. And for some reason that slips my mind at the moment.
541-2222.
There you go. Thank you, Mrs. Pelham. You get an assist. So, call the non-emergency number if you have questions regarding that, or if it's during the work week, you can contact our Department of Development, particularly with the trash toter issue. They handle the enforcement of that. So contact the Department of Development, 541-2220. Or you can use your app. We have a click to report app that you can use to report violations. You can download it off of our webpage. So go there and then you can report through your phone. That shows up in our TIM system, which tracks all of our incidents. So that's another way to do that, is to go to our webpage, download our app, and then you can report incidents through the app.
Thank you. And the council submitted questions. That was just, he worked very hard to get those done in advance of our next meeting. So this is just for you guys to peruse prior to our next city council meeting, not to literally go over right now. Correct, Mr. Altman?
Yeah, and we've got a couple questions that we need to answer a little bit more, and we'll have those ready for you at your next meeting,
Thank you. That's all the updates we have for the city manager. Is there any questions as of right now for him?
And I think just to make sure council knows, we can email all these we can email all the documents if you need them to you again, if that's necessary. I've got some PDFs and I can send them out this evening before I leave, but I know I went through a lot, particularly the questions and answer, that one piece. I can certainly send that to you before I leave this evening.
Thank you. So we're near the end of the meeting. The next item is state updates. We're going to keep that very general. As the manager talked about, we have Executive Order 53 and 55. For the public that's watching, those executive orders are included in our packet. And for the public guidance, if you have questions regarding those executive orders, the best point of contact is the governor's office and the information he's made available online. As the city manager noted, the governor has created a frequently asked questions page and is broken down by multiple categories for people to be able to ask questions in terms of personal, business, church, outside, or whatever. So that link is right here and it's in the packet. It's broken down by business, workers, children, families, outdoor recreation, and pets. So that should cover a bulk of a lot of people's questions. If it doesn't, then we could try to help send those to the appropriate authorities to get you an official answer from the state. Also, Mr. Altman did cover the tax deadlines for the state as well. And that information is included in the packet. Thank you, Mr. Altman, for touching on that. The other information that we thought would be helpful for the public, in addition to the executive orders and the frequently asked questions, is Mr. Altman found a timeline from the state in regarding what they have done for COVID-19. And we have included that in the packet in case people are interested in seeing all of that information. One thing in regards to the state, I got a question from a member of council to ask for guidance on in regards to the enforcement of that, and the city attorney has just a very brief high-level response for those in terms of enforcement. Ms. Robinson, are you on the phone still?
Yes, ma'am. Can you hear me?
Yes, ma'am.
Okay, so the governor has issued 3 executive orders since the start of this. The first one, 51, was in fact the declaration of emergency for the state of Virginia. And since then, he ordered executive number 53 and 55. The most recent one, 55, is a stay-at-home order, and in that there are several provisions that carry criminal penalties if you violate them. And so the criminal penalty would be as a class 1 misdemeanor. For those of you who are not familiar with the penalties in criminal court, a class 1 misdemeanor carries a fine up to $2,500 and or jail time up to 12 months. The provisions of the stay-at-home order that are subject to criminal penalty, and not all of the provisions of that order are subject to criminal penalty, are the followings. If you violate the provision that limits public gatherings to 10 people or less. So if you are more than 10 people, you are potentially subject to being charged criminally and obviously punished on a criminal basis. If you are an institution of higher education, in this case, it would be college age or colleges or university level institutions, if more than 10 people are gathered for any purpose other than what has been set forth in the order, those instances are subject to criminal enforcement as well. And the third provision that subjects you to criminal penalties are for I guess staying in public campgrounds for periods over 14 days. And lastly, if you are on a beach that was closed and you're doing something other than exercising or fishing, you could be subject to some criminal penalties. Some of these provisions are duplicate of the criminal penalties that were set forth in the Executive Order number 53. When 53 came out from our review of the order, we tended to say that the criminal penalties only were applied to violations of the 10 people limitation. So those that were gathering more than 10 people, if it was at a fitness center, a restaurant, or one of the other public entertainment facilities, you were subject to some criminal penalties. In terms of whether or not this is going to be enforced or is going to be easily enforced, we really can't say. We can't say at this point, frankly. So take, for instance, a gathering over 10 people. I mean, if it's 15 people, how do you come in charge? Do you charge all 15 people? Or do you charge the last 5? So there are some obvious problems with enforcement on some of these provisions, but I think the only thing that we can actually safely say to our citizens is that take these executive orders very seriously. Our police chief has been authorized to assist in the enforcement of the state executive orders as well as the federal executive orders. And so at some point in time, based on the behavioral response of the community, the governments, whether it's on the local level or the state level, might decide that enhanced enforcement is necessary to protect the community at large. And so rather than to kind of create a false sense of security as to what's going to be enforced, what's not going to be enforced, we simply suggest that you follow all of the provisions of the executive orders. And if you have any questions, direct them to probably the most logical contact at that level of government. The Secretary of the Commonwealth is a good place to start on the state level. In terms of the federal level, I guess it would depend on what the provision is intended to cover from a subject matter standpoint. Also, at least on the local level, our police chief will be making decisions as to how much enforcement is needed to ensure compliance and to protect the public. And so if you have any questions about enforcement on the local level, a call to the police department might be a good starting point. And Mayor Gore, that is all I have relative to the executive orders from the Governor Northam. Unless there are some questions, my presentation is complete.
Thank you. Ms. Robinson, I appreciate that. Is there any questions regarding the executive order? I think we try to cover the ones that were coming in. Anything else regarding that, council?
No.
And just make sure okay, good. The other, before we move on, because we're almost at the end, while Ms. Robinson is on the phone, we're moving down to SB 9, items for council consideration. I also want to be very clear, when I prepared this agenda packet with city manager, I tried to put in all the feedback I was getting from the public, other members of council, to make sure we had everything into one location. So some of this is not meant to have a discussion tonight, just like the questions, and city manager said he'll be adding the rest of the answers to that. Mr. Altman, please make a note that we do need to circle back about the fishing license question that was sent over. I think that might be with the Commissioner of Revenue's office to provide a response. I'll follow up with you later on tonight. But in regards to items for council consideration, there's discussion about looking at a citywide mask policy. Talked to the city attorney about that. Madam Attorney, you just want to give like a 1 minute thing about why that probably at this time wouldn't be feasible regarding the checks and balances for state and local government?
Yes, ma'am. The state of Virginia follows the Dillon rule of construction. And so basically local governments can't do anything more than what is authorized to them by the General Assembly or the state level government. In this instance, Governor Northam has merely suggested that the public face masks at certain public locations. And so the city could not, under the law of supremacy, come and adopt an ordinance or a regulation that would require the citizens to wear a mask when it's not required by the state as a whole. And so you can't do anything more than the level of government above you under the law of supremacy. So we cannot have that regulation as of this moment. We are saying that today. At any point in time, the governor might change that regulation to make it a requirement, similar to initially at Executive Order number 53, we were told to try to stay at home as much as possible, and now we have a stay-at-home order. Things are changing very rapidly, so if we don't want to get to a place where a regulation is in place that we must wear face masks when we go out in public, I think we have to try to comply with that reasonably enough for the governor to feel that the community as a whole is not further exposed to losses because people simply have disregarded his request that we wear face masks as much as possible.
Thank you, and probably will call on you for the last two items. There's been discussion about if council can do one of two things. First option is take leftover travel and put it to your ward fund, or either to donate for different reasons. I looked into seeing if we could do this, not to give to a department per se, but to see if we can give it to people within the community or organizations that are helping in response to COVID-19, whether that be the remaining travel money for the collective fund. I've included in this packet council's ward improvement fund policy that says that you cannot transfer money from outside funds to our individual ward accounts. But then also I did not add in this, but we'll email at the end of tonight's meeting, the guidance that says what is permissible to be donated, organizations that are authorized to receive donations from the city. So the question was, could we use our individual ward accounts to do donations, or if we could take council's bulk travel money that's left over as a whole to provide donations to people who are doing resources, either nonprofits, businesses, or individuals. Unfortunately, at this time, it doesn't seem like that's feasible given the guidance from the state in terms of how we can donate funds. So we'll be looking at that if that's something council wants to continue to pursue. But as of right now, if I'm misunderstanding, Ms. Robinson, please correct me, but based off of how we can donate right now, that's not possible, correct?
That's correct. And that's actually two parts. So under your ward improvement fund policy,
somebody's talking in the background, please. All right, go ahead, Ms. Robinson.
So under that policy, there are 5 categories to which you can utilize, or in which you can utilize your funding. One is for public improvement to public lands. The second is to purchase of property or equipment which will be owned by the city. The third is for public events or programs sponsored by the city, or to an organization in which the city has specific authority to make donations. Fourth is the public school programs, and 5 is to organizations to which the city is authorized to donate by state code. So under that policy, there's clearly not an objective delineation for using that money to assist with for-profit organizations or individuals. Now, under that 5th category, where you can give to organizations to which the city is authorized to donate by state code, that would too now extend to your question as to whether or not you could use leftover travel money to donate to someone who's in need in the city. Under the state code, localities are authorized to donate to certain organizations. But again, when I said earlier about us being a Dillon rule, you can only do as much as the General Assembly has authorized you to do. And at 15.2-953, the types of organizations to which a locality can donate to are specified here. And again, if you go through that particular section of the code, for-profit businesses are not eligible to receive public funding, except maybe as through economic development and through whatever the financing is available through the local IDA or EDA. And there are no provisions in that code section for a locality to donate to an individual, regardless of what is going on with that individual. If that person is not set up as a nonprofit organization or corporation, they're just not eligible to receive money. And council has no authority to create or to create a regulation or an ordinance that will circumvent this particular section of the state code. And so really, I don't think that there's going to be many local options for us if the idea is for us to take city funding and give it to an individual or a business that is in need in the city of Hopewell. The city council is as constrained by this statute as the city is. So as of this moment, if there isn't a all existing statutory authority to give this money away to an individual business or an individual, it's not likely to occur, at least with public funding.
Much. And the last update we had in terms of announcement, John Randolph Medical Center sent out emails to community partners asking for any messages of encouragement, whether it be photos, letters, pictures, or videos 2 minutes or less under to be submitted. I'm working on creating a form to capture that information so we can share it with the hospital. But if there's anyone that's supporting our healthcare workers, they would like to capture that. Likewise, the governor is doing something with Hunger Heroes, meeting our school systems and those in our community that are providing meals. I'm also going to add a spot on that form to capture that information. And then additionally, if you have people in our community that are making masks, doing donations, and doing what they can to help out Hopewell in the time of COVID-19, I'll add that to the form so the public can, submit that information, drop photos and pictures and videos so we can share it with our community partners, and also, statewide in terms of what people are doing here in Hopewell to band together, because we are all in this together. And so whenever that is established, I'll make sure that it's sent out. I'm going to be working with the CMP. We talked about some initial things, but I'll circle back to figure out how best to make that form work for everyone so it's feasible. I don't have any other updates. I try to capture everything that was sent to me for this meeting. I want to definitely thank Mr. Altman for his hard work. He worked very hard this weekend and late last week to try to capture this information because you want to have a full packet, and we did get it out this evening, but hopefully the public is fine with the delay because we had as much information as possible for you guys to have on record. And we'll probably update this this presentation to include the hotline number and some of the other things that were mentioned just to make sure it's full. We can probably post it on the city's website afterwards. And then I also want to thank Ms. Robinson for looking into these legal questions for us to make sure we had feedback for the public as well, and all the other members of council who participated and were willing to meet tonight. So council, are there last minute questions of staff before we adjourn this meeting?
I make a motion we adjourn the meeting.
Okay.
All right, so there is a motion to adjourn. I take
your hand.
There again.
I said there was a motion to adjourn. I take it no one had any questions because I was trying to get to the screen, but
I seconded it.
Hmm?
I seconded the motion to adjourn.
Oh, okay. There's a motion on the floor by Councilor Dutton and seconded by Councilor Randolph. Now it's before council. Is there discussion?
Yes. Before we adjourn, I would just like to thank all the panelists again.
Point of order.
Yes, there's a point of order by Councilor Denton.
We don't need to discuss an adjournment.
Thank you.
Oh, that's fine. I was just trying to make sure everyone had a chance to speak and thank everyone, but that's fine. Roll call, please.
Sorry. Councilor Parton?
Yes.
Mayor Gore?
No. Let people comment.
Councilor Denton?
Yes.
Councilor Pelham?
Of course, no.
Vice Mayor Bennett? Hello?
Yes. Yes. Can you hear me?
Yes, thank you. Councilor Randolph?
Yes.
Councilor Holloway?
Yes.
All right, the meeting adjourned. Thank you, everyone. Councilor Pelham, I guess send your thank yous to staff and everybody else after the meeting. Everybody have a good night and be safe. Thank you.
Good night.
Good night.